Hi, everyone, and welcome to our Catalyzing Communities webinar. My name is Christina Economos, and I'm a professor of nutrition at the School of Nutrition Science and Policy at Tufts University, and also the principal investigator of Catalyzing Communities. So for many of you who are familiar with Catalyzing Communities, you know what we're all about, but for those of you who are not, we work with coalitions around the country with the goal of promoting policy systems and environmental change that equitably and collectively improves health outcomes for all children. We use our unique stakeholder-driven community diffusion approach to help identify, implement, and sustain evidence-based solutions. We're currently working in 8 communities across the country, and for more information, I would encourage you to visit our catalyzingcommunities.org website. So today is part of our Learning Collaborative, which is an interdisciplinary network to bring together Catalyzing Communities coalition members, community stakeholders, activists, researchers, scientists, data analysts, and other partners. The goals are to center equity and learning, cultivate a robust network for professional support, reverse the trends that drive health disparities, and create a paradigm shift to systems thinking. We're conducting workshops like today, lunch and learns, and opportunities to learn from each other. Today is our first keynote address, and I'll introduce our speaker in a moment. And there's lots more to come in 2022, and we hope you'll join us for those events as well. If you have questions throughout today's webinar, please feel free to use the Q&A button at the bottom of your screen to ask them, and we will be monitoring your questions throughout. So without further ado, I have the pleasure of introducing our keynote speaker, Dariush Mozaffarian, who's a cardiologist, dean, and the Jean Mayer professor at the Tufts Friedman School of Nutrition Science and Policy, and a professor of medicine at the Tufts School of Medicine. His work aims to create a food system that is nutritious, equitable, and sustainable. Dr. Mozaffarian has authored more than 450 scientific publications on dietary priorities for obesity, diabetes, and cardiovascular diseases, and on evidence-based policy approaches and innovations to reduce these burdens in the US and globally. He has served in numerous advisory roles, and his work has been featured in a wide variety of media outlets. Thomson Reuters has named him one of the world's most influential scientific minds. And Dari is my boss, and I'm proud to introduce him and honored that he's made the time to be with us today. And thank you so much for coming. Please welcome Dari.
Thank you so much. It's such a pleasure to be involved with this effort and in this webinar. I know that Chris has led so many amazing efforts at the school and nationally, and I think this Catalyzing Communities is just another wonderful example of how science can be translated into real progress and action for people who need better nutrition and improved health. And so I'm going to talk about diets in children, what's going on in the United States, the trends in diets in children. And my talk is about 30 minutes, and then we'll have plenty of time for questions and discussion. So let me pull up my screen. Hopefully everybody can see that well. And so, first, I just think the place to start is that we are really, really sick as a country. And this is also relatively new that we're this sick as a country. So today, more American adults are sick than are healthy. 1 in 2 adults in our country have diabetes or prediabetes. 3 in 4 have overweight or obesity. And actually only 1 in 10 are metabolically healthy. If you just look at some basic definitions of good metabolic health, 9 in 10 American adults are not metabolically healthy. So it's by far the norm to be sick, not to be healthy. And that is overwhelmingly due to diet-related illness, and most of this is new in just the last 30 years. And among American teenagers, 1 in 4 have prediabetes, 1 in 4 have overweight or obesity, and 1 in 6 have non-alcoholic fatty liver disease. So just shocking trends for the future of our country. And in addition to the crushing, health costs, this has crushing economic costs. In just 50 years, healthcare costs have gone from about 7% of our economy to 18% of our economy. from just about 5% of the federal budget to 30% of the federal budget and to 30% of average state budgets. From $80 billion of healthcare expenditures for US businesses to now $1.2 trillion for US businesses. And we're now spending over $11,000 per man, woman, and child in the US on healthcare every year, or over $44,000 for an average family of four, which is more than most families pay for housing, food, and transportation combined. So this is not sustainable from a human health point of view or from an economic point of view. In fact, 80% of healthcare dollars today are spent on preventable chronic diseases. Many of those are diet related. And just diabetes alone, the US government, including the federal and state governments, spend $160 billion on direct medical care for diabetes alone. That's more than the entire budget of the USDA and the Department of Education combined. And this has been quantified, in a recent report by the Rockefeller Foundation on the true cost of food in the United States. And so what this report did, which just came out this summer, was to look at what we actually spend on food and direct purchasing and agriculture and so on, and what the implications are for our economy. And what the report found was that we spend about $1.1 trillion per year on food through all the ways we buy and ship and grow food. And then for that $1.1 trillion that we spend, in addition, our economy loses another $2.1 trillion every year, about half of that being due to losses in human health from healthcare expenditures and lost productivity. And then of the remaining half, about 2/3 or more being due to environmental losses and biodiversity losses, and also lost livelihoods from underpayment and lack of benefits and child labor and so forth. But so think about that. For every dollar we spend on food, our economy loses $2, and just half of that is from health consequences alone. So this is not a winning proposition. And what I think is really important about this report and about true cost of food analyses is that this highlights the economic consequences. I think if we just talk about food and nutrition as a moral issue or a health issue or an equity issue, we're going to be mostly talking to the people who are already champions, who already care, who are already excited and enthusiastic to make a difference. And most other Americans who aren't passionate and excited aren't really going to pay attention. And so if we want to get everyone to pay attention, I think this economic argument is incredibly important. That this is not just a health and equity and moral issue, this is an economic issue for our country. And COVID-19 has put an exclamation point on this. If you have a diet-related disease like obesity or diabetes or hypertension, you're 12 times more likely to die if you get COVID than if you don't have one of those conditions. And that's because COVID-19 is a vascular inflammatory virus, and common diet-related diseases like diabetes, obesity, and hypertension are all vascular inflammatory diseases. And so you have a vascular inflammatory virus attacking a very sick population our population is ridden with vascular inflammatory diseases like diabetes, obesity, and hypertension. And in fact, we published an analysis earlier this year finding that if you put together major common diet-related conditions, 63% of all COVID-19 hospitalizations might have been prevented if we didn't have those conditions in our population. That represents about 600,000 excess hospitalizations last year. And the top overall cause was obesity, second was high blood pressure, and third was diabetes. So we could have prevented maybe 2/3 of all hospitalizations and therefore deaths if we had a metabolically healthy population. And so this is really important as we're talking about ways to be resilient to future threats and pandemics. So if we really want to advance nutrition in this country, I think we have to change the conversation away from just food security to nutrition security. There's been a lot of attention over 25 years in this country on food security, and many of you in your communities appropriately have been focusing on advancing food security. And that's done a lot of good. But at the same time, nutrition has been underemphasized. And so there's a new concept that the USDA has really embraced called nutrition security, which we define as consistent access, availability, and affordability of foods and beverages that promote well-being and prevent, and if needed, treat disease. And I think this is really crucial to move beyond food security as a term to defining and screening for and measuring nutrition security, because we have to emphasize food quality, not just access to calories. And Secretary Tom Vilsack has been an incredible champion for this. My hat's off to him. In his confirmation hearing in February, he said, our nation suffers from nutrition insecurity. We must do more to ensure access to the nutritious foods that can protect and promote health. And so how are we doing? How are we doing among children for advancing nutrition? What this chart shows is the proportion of US children over approximately 20 years of data that have poor diet quality, poor nutritional quality, intermediate nutritional quality, and ideal diet quality in the United States. And we can pretty much dispense, unfortunately, with ideal diet quality down here in blue. Less than 1% of American kids have ideal diet quality. If you look overall, things are actually improving. The proportion of kids with poor diet quality has gone down from 77% to 56%. And the proportion with intermediate diet quality has gone up from 23% to 44%. So on average, actually, kids' diets are slowly improving. And what is that from? Why is that improvement occurring? Well, first, there has been an increase in consumption of whole fruits, still pretty low, from about 0.45 servings per day on average to about 0.7 servings per day on average, but there has been an increase in whole fruit intake, which is positive. Unfortunately, no change at all in vegetable intake, really. White potatoes are still the top vegetable consumed among American children, and other vegetables consumed at much, much lower levels. Many, many vegetables less than 0.1 serving per day on average. So an improvement in whole fruits, still low, very low intake of vegetables, and no improvement. Dairy consumption, cheese consumption has gone up. And actually yogurt consumption has significantly gone up, but at such a low level that it's even hard to see. But this is a significant improvement, but still incredibly low. And really interestingly, very little change in consumption of meat, fish, or eggs, except that consumption of poultry is going up a little bit. Consumption of unprocessed red meat is going down a little bit. We wouldn't anticipate that to have major impacts on health, as those meats are pretty neutral for health. And unfortunately, intake of seafood down at the bottom really hasn't changed. And intake of processed meats, which are harmful, really hasn't gone down. And then lastly, looking at carbohydrates, intake of whole grains has significantly gone up, but still very, very low, from half a serving per day on average to a whole serving per day on average. But intake of refined grains has not gone down at all. And probably the biggest single overall improvement has been reduced intake of sugar-sweetened beverages, which have gone down in half, from about 2 servings per day to 1. So if you look at the whole US population, kids' diets have improved. It's been largely due to a modest increase in whole fruit, a modest increase in yogurt, a modest increase in whole grains, and a significant reduction in sugar-sweetened beverages. But still a long way to go, and still most kids don't have even okay diets. The second key point is that there are, of course, disparities in these improvements, and you can see disparities by education, by income, and by race and ethnicity. What this chart shows is the disparities by income. So this is the same chart, but just looking at poor nutritional quality diets among children in the United States, the proportion stratified by the ratio of family income to poverty in the United States. And so at the lowest income levels, household income levels, still more than 2/3 of American children still have poor nutritional quality diets. At the highest income levels, it's about 47%. So you could look at this in two different ways. First, you could say, wow, there's terrible disparities. If you have higher income, kids have much better diets, and that's true. At the same time, you can also look at this and say, even for kids from high income households, half have poor nutritional quality diets. So income alone is not going to solve the problem. There is just a huge problem with nutritious diets for children in our country. Now, if we want to start to address this, we have to, in your communities, nationally, we have to start thinking about the food sources. And what's really interesting is the sources of calories for US kids really have been stable over the last 20 years. And so this chart shows the percentage of calories among kids from different food sources, from grocery stores, restaurants, schools, and other sources. Other sources include entertainment venues, food trucks, food banks, other places. And you can see that on average, schools, which get a lot of attention for childhood nutrition, have been about 9% of calories year round. And that surprised people when we published this, but this actually makes sense. Kids are on school only about half the year, 180 days per year. They don't eat all their meals in school. Many kids don't eat school meals. This is just calories from school meals. And so for the average American kid, it's only about 9% of calories year round. And whereas in contrast, grocery stores are 2/3 of calories. And then restaurants are about 20% of calories. So if we really want to improve kids' nutrition, of course, we need to continue to focus on schools, but we really need to focus on grocery stores and the choices that parents are making and the food that's available in grocery stores and on restaurants in particular. So let's look at nutritional quality by those food sources among US children. And so this is the same chart looking at all children in the United States, looking at the proportion of foods and beverages of poor nutritional quality from the different food sources. What's striking is first, restaurants are a terrible place for kids to eat. 80% of food from restaurants in the United States that kids eat today is of poor nutritional quality. Now, this is not an analysis of what's on the menus. This is not an analysis of what's offered. This is an analysis of what kids are actually eating and consuming from restaurants. And so 80% of the food consumed from restaurants by kids is of poor nutritional quality. That's a combination of fast food and full service restaurants. Full service restaurants are a little bit better than fast food restaurants, but on average still, restaurants are not a healthy place for kids to eat. And then you see food from other sources, which is again, entertainment venues, food trucks, food banks. The proportion with poor nutritional quality is actually worsening. It was about 40%, and it's gone up to over 50%. So food from those sources is worsening. In contrast, from grocery stores, the food consumed from grocery stores is actually slowly improving from about 55% poor to about 45% poor. So over 20 years of effort, we've made a little bit of improvement from grocery stores, we've gotten worse from other sources, and we've had really no major improvement in restaurants. Now, I want to contrast those three graphs, restaurants, other sources, and grocery, to schools. Look what happened in schools over this time period. In blue here, you see the proportion of foods from school meals that are poor nutritional quality. Between 2003 and 2010, between 55 to 60% of all food consumed from school meals is of poor nutritional quality. Many of us who have kids at these ages or in public schools ourselves previous to 2010, this is kind of the conventional wisdom about school meals. They're terrible, right? 60% poor nutritional quality. But look what happened after 2010. After 2010, a dramatic, rapid improvement in school meals, a dramatic decline in the proportion of meals with poor nutritional quality, so that by 2017, 2018, which is the latest year with national data, only 24% of food at schools is of poor nutritional quality. Again, you can look at that as a pessimist or as an optimist. The pessimist would say, still 24% of meals in schools is of poor nutritional quality. That's much too high, and I agree. On the other hand, today, schools are actually the healthiest overall place for kids to eat in America. And in fact, school meals are the healthiest overall source of food for kids or adults. They're healthier than any food source for adults. So what happened in 2010? Well, we know what happened in 2010, passage of the Healthy Hunger Free Kids Act by Congress. Congress passed a law creating much more rigorous nutrition standards for school meals, and it worked. And so for me, this is really the take-home message that I think we can take away from kids' meals today. On average, nutrition for our children in this country is terrible. It's improved a little bit in grocery stores, which represents, huge amounts of work by advocacy groups and government and industry and education and dietary guidelines to get people to shift towards healthier choices and to get food companies to start creating healthier products. We've gotten a little bit of improvement. In contrast, really no improvement in restaurants, and from food from other sources is worsening. And then compare all of that to the power of a single policy passed by Congress. A single policy passed by Congress rapidly and permanently improved nutrition for millions and millions of kids practically overnight. And so to me, this is the take-home message. We really need to be looking to the power of policy, whether it's policy at our community level, at the city level, at the state level, or at the national level. When more adults are sick than are healthy from poor nutrition, when 1 in 4 teens have prediabetes from poor nutrition, the system is broken. And so we need to fix the system with systems changes. Now, the other advantage of policy is it addresses equity. So what this chart shows is the same graph I showed you before, the proportion of kids up the top and the proportion of adults here at the bottom, with ideal, intermediate, and poor diet quality. And so we can just look at blue, the blue lines, which is poor diet quality. And this is stratified by low income, middle income, and high income households. And this is looking at the nutritional quality of food from grocery stores in the country. And so what you can see what happened among adults. Let's start with adults. Among adults of low income households, the proportion of meals of poor nutritional quality from grocery stores went down a tiny bit. If you look at middle income households, it went down a tiny bit. If you look at high income households, it really went down significantly. And so really what we see among adults, most of the improvement that we see happen in high income households in terms of food from grocery stores, with much less improvement in middle and low income households. And if you look at kids, it's even worse, really no improvement at all from food from grocery stores in low and middle income households. All of it's in the high income households. And so you see that all of the efforts of the last 20 years to improve the nutritional quality of food in the United States has actually worsened disparities, worsened nutritional disparities, worsened the health disparities. Now, in contrast, let's look at schools. This is the same chart for schools. Now I'm not showing you children and adults, obviously, because adults don't eat school meals, but I'm showing you children by race and by income. And what you can see is whether you look at children of white background, Black background, or Hispanic background, or low income households, middle income, or high income households, the improvements were completely similar, entirely equitable after 2010. Dramatic reductions in the food of poor quality, regardless of race, regardless of income, and also, I'm not showing here, regardless of parental education. And so again, the take-home message is the power of policy. Policy change can remarkably improve nutrition quality for Americans and do it equitably. Really, really powerful, I think. What about other aspects of diet quality? What about junk food and ultra processed food? There's a lot of increasing evidence that junk food and ultra processed food are both really harmful for health. So let's look at these trends. So first, let's look at trends in junk food. Now, this excludes beverages. This is actually junk foods because as I showed you, sugar-sweetened beverages have gone down significantly. If you look at trends in junk food intake in US children, there's been no improvement in 20 years. So with all the messaging and all the efforts and everything we've tried to do to reduce junk food intake in the United States, there's really been no change at all. And on average, almost 1 in 5 calories in the United States that kids eat, 18% of calories, comes from junk food. So that's just incredible, right? 18% of calories on average comes from junk food in the United States. And what's interesting here, a couple of things. One, if you look at the sources, most of this is from the grocery store, so even more than the average food. And so this is mostly under control of the parents, or for older kids, their own purchasing. So this is something that we have not addressed well in this country, as choices around junk food purchasing. Secondly, if you look by race, ethnicity, or you look by education, I want you to look at these colors closely because the colors will surprise you. These charts are the percentage of calories from junk food, so higher is worse. So the highest percentage of calories from junk food in the United States is actually for white kids and Black kids, and the lowest for Mexican American kids. And if you look by education, the highest intake is actually for some college or above, by parental education. The highest intake is for families have parents with higher education, and the lowest intake is for families who have less education. So here for junk food, interestingly, the typical disparities we see in nutritional quality are reversed. And so I think what this suggests is that junk food is really a luxury purchase item, and families that have lower education, you see the same thing by income, actually have less junk food than higher income families or higher education families. And here, Mexican American kids have less junk food, probably because of, I think, a little bit less acculturation, and there's still, on average, more cooking toward traditional foods in Mexican American households than non-Hispanic white or non-Hispanic Black households. So interesting and different trends by race and education than we see for overall nutritional quality. And if you look at ultra processed foods, which is a different definition that has to do not with the nutrition, but with the processing, this is getting worse. Over the last 20 years, the percentage of calories from ultra processed foods has gone up for US kids from 61% of calories to now 67% of calories. So 2/3 of all calories consumed by kids now are highly processed foods. And what is that from? Well, these are all the trends. This is comparing the percentage of intake from different categories of ultra processed foods, looking at 2017 and 18 in blue compared to 1999, 2000 in yellow. And so what are the big changes? Well, the big improvements, as I've mentioned, are sugar sweetened beverages. Sugar sweetened beverages have gone down dramatically. Sugar sweetened beverages have gone down from about 12% of calories among kids down to 5% of calories. And so a big drop in consumption of sugar sweetened beverage. That's been a positive. On the other hand, that positive has been offset by increases in other categories. By far the biggest increase is in ready to heat and eat mixed dishes, and also to a lesser extent, sweet snacks and sweet bakery products and desserts. But the biggest increase is ready to heat, ready to eat mixed dishes, which have gone from about 3% of calories in 1999, 2000 to 12% of calories, a fourfold increase over this period. And so this really highlights, I think, struggling families, who are buying pre-prepared, ready to heat and eat mixed dishes rather than able to scratch cook at home, and highlights the challenges to our country. And again, if you look at differences in ultra processed food intake by race, ethnicity, and family income to poverty, you don't see the typical disparities you see for nutrition. So again, Mexican American kids have less ultra processed food intake than Black or white kids, although the steepest rise has been for Black children. And really no difference by income. Income is not a predictor of this. So all income levels are I think, eating far too much ultra processed foods. So in summary, I think since 1999, overall diet quality has slowly improved in kids. Poor diet's gone down from about 77% of kids to 56% of kids. That's been due to more whole fruits, more whole grains, more yogurt, and less SSVs. But still, 56% of kids have a poor quality diet, and there's major continuing disparities by race, income, and education, and overall nutritional quality. By food source, there's been little improvement in food from restaurants, a little bit of improvement from grocery stores, and worsening from other sources with disparities. In contrast, huge improvements from schools, equitably, all occurring after the Healthy Hunger Free Kids Act. Junk food is nearly 1 in 5 calories, not decreasing, and ultra processed foods are increasing now in 2 and 3 calories among US kids. Grocery stores are the major source, and the intakes here, interestingly, are highest among whites and non-Hispanic Blacks, and lowest in Hispanics, and really not traditional disparity differences by household income or parental education. So if we want to fix this, I just want to end by highlighting some key points. If we want to fix this, as I said, we have to have systems changes. This can't be done at the individual level, blaming the individual, expecting the individual to navigate this broken food system. We have to fix the policies. And so, at Tufts, we've done a lot of research, and I think we've outlined and highlighted and identified 6 domains where there are clear actions we need to take to improve nutrition security in this country. First, science and research. Second, integrating food and nutrition into healthcare. Third, leveraging the federal nutrition programs. Fourth, advancing business innovation. Fifth, accelerating and investing in public health and education. And lastly, having a real national plan and coordination. And so I'm not going to have time to go into all of these, but I just want to highlight a couple of key points. Under science and research, we must have a National Institute of Nutrition at NIH. NIH is the science leader for our country, and it doesn't have an institute focused on nutrition, the top cause of poor health. And so we absolutely have to advance research in this country on nutrition. In healthcare, we need to integrate food as medicine approaches like produce prescription programs, medically tailored meals, coverage for RDs to see patients and provide guidance, nutrition education for doctors, and more. We need to leverage our nutrition programs, particularly SNAP. WIC is excellent, but SNAP doesn't leverage nutrition the way it could. I think that has to be done so that SNAP is a better investment to advance both food security and nutrition security, since it's such an important program to address hunger. We have to strengthen the school meal standards. We saw what a powerful effect they had. And so I think with child nutrition reauthorization coming up next year, everyone has to advocate to double down and further strengthen the school nutrition standards. And there's other things that could be done in schools. We have to advance business innovation. We have to leverage the power of the private sector by the federal government really stepping in and creating programming and incentives and tax policy and innovative financing to advance this whole sector. And that should include advancing ownership of these businesses by people of BIPOC backgrounds. And so I think that's crucially important. BIPOC owned food businesses are actually the #1 small business started by BIPOC individuals, and it's the #1 source of new jobs in BIPOC communities. And so at Tufts, we're very interested in creating kind of a national ecosystem to help spur BIPOC food entrepreneurship. And the federal government has done this for other industries. They did this for railroads, in the last century. They did this for healthcare in the last century. They've done this for green energy. The government has a long history of stimulating specific industries for national interests. It's time to stimulate innovation in food and nutrition to create more nourishing, equitable, and sustainable food. We have to advance public health and education through leveraging the power of the FDA and the CDC and the dietary guidelines and the Federal Trade Commission and the CDC. There's a lot that can be done here. And lastly, we have to have national coordination. This is probably, among the biggest issues facing our country. I would say top 3, if not top 1 issue facing our country. If you put together the health impact, the equity impact, and the economic impact of diet-related diseases, and yet we have no plan. We have no coordinated national plan. And so we have proposed at Tufts the need for a new national director of food and nutrition in the White House. We're really asking the Biden administration to host a White House conference on food and nutrition, hunger and health during this administration, and several members of Congress, both in the Senate and the House, have proposed a bipartisan bill asking the White House to host a conference. We really need to have a national strategy. And so just want to end and leave time for questions. As I've outlined, we are facing an unbelievable onslaught of health, equity, and economic consequences of poor nutrition. And at the same time, I'm an optimist. All of this is addressable. All of this is addressable, rapidly addressable, if we actually have a plan. And we need to advance science and research. We have to advance food as medicine and healthcare. We have to leverage our federal nutrition programs, catalyze private business and jobs, advance public health and education, and actually have federal food policy and coordination. In 1969, 52 years ago, was the last time that the country came together and actually created a plan around food and nutrition. The focus in 1969 was hunger. And there was huge advances from the 1969 conference: expansion of food stamps, expansion of school lunch, creation of school breakfast, creation of WIC, creation of nutrition facts, much, much more. That conference was organized by Dr. Jean Mayer, who was the founder of the Friedman School of Nutrition Science and Policy at Tufts. And so Tufts is, I think, trying to complete this circle, and now 52 years later, convince the White House that it's time for a second White House conference on food, nutrition, hunger, and health. Thank you so much, and happy to answer any questions.
Great. Thank you so much, Dari. That was excellent. We have a number of questions that have come in, and I also have a couple of questions I want to just start with. I think we have time to get to everything. Given that you're a physician, I want to take advantage of something you said right at the beginning, which is, metabolically healthy children. And maybe just spend a moment, and I can jump in with some of this as well. What do we mean by a metabolically healthy child? A lot of us, who have had children, bring them in for well child visits, and we know they get weighed and measured, and they get, immunized, and they get asked some questions. But, what does that mean under the skin? What would we really want to see in a population of metabolically healthy children?
Yeah, so I think, metabolic health can be defined pretty clearly in both kids and adults as the absence of a range of diet-related metabolic abnormalities: high blood pressure, abnormal levels of blood cholesterol, abnormal levels of blood glucose, a healthy liver that's not inundated with fat production from eating too much starch, sugar, and protein, low levels of chronic inflammation, are all, and of course, a normal weight in terms of particularly extra, adipose tissue, especially visceral adipose tissue. And so we know all those things very, very clearly. And again, what's shocking is for the first time in human history, we have 25% of kids that have prediabetes, 25% of kids that have fatty liver. So we have huge, huge numbers of unhealthy children. And among adults, if you just look at those metrics, 90% have at least one or more of those, levels not at ideal levels. And so, so I think it's really clear how to define it. Now, the key question is, how problematic is it to have it in children? Can they just outgrow it? Can you do other things? So I think there it's again, glass half full, glass half empty. We know, of course, that at any age in life, you can change your lifestyle and improve your health. And so you could do it at age 80. You can be unhealthy your whole life, and at age 80, change your lifestyle and substantially, reduce your later morbidity and mortality. But we also know that the habits that are instilled and put into practice in childhood are very, very likely to stay on in adulthood and are very, very hard to change. And we also know that especially obesity, once obesity and overweight develop, it's very hard to reverse. And so I think that kids today, while any child of any metabolic health level can get better or get worse as they become a young adult and a middle-aged adult, and we've seen it ourselves among our friends and family, right? People can go in both directions. On average, it's much, much better to enter adulthood healthy and with healthy lifestyle habits. And so I think, we see from all measures that our kids are not metabolically healthy the way they should be right now. And it should be an absolute emergency that we should be addressing with the same urgency as the COVID-19 pandemic. I mean, the consequences of this for the health of our country are much, much worse than the entire COVID-19 pandemic has been. And yet, because it happens over years, instead of happening instantly in front of our eyes, we don't react as humans with the same, fight or flight reaction that we've evolved to react to a saber-toothed tiger, right? This is a smoldering volcano right on the horizon that's going to kill us next week or next year, but we don't react to it in the same way.
Yeah, great. Thank you so much. So I'm going to turn to some of the questions now. And the first one is around school lunch and school breakfast. And the question is, what percentage of children are actually selecting meals versus bringing them from home? And how does the quality compare? And I'll let you answer that. I'll add as well, because we've actually analyzed that, as have many people. And also, it looks like we are making progress, and hopefully this is going to translate into school breakfast and beyond. And just to note, we approved for this year universal free school meals, and there's a lot of debate going on right now about the extension of that. And states like California have taken the lead to say, we're institutionalizing this. It's not going to just be low-income children. I think a lot of the data that you showed that you've been part of, Dari, has been cited as one of the reasons. It's the healthiest food that kids are getting. So I'll let you answer that first, and then I'll jump in as well.
Well, I don't know the percentages. I know the majority in schools that offer free or reduced price school meals are eating school meals, but I don't know the exact percentages. It probably varies by state and by income, and you could probably answer that better, Chris. I will say that I know, and again, you've published this, others have published this, you can comment on that, that there's very clear evidence that the food brought from home on average is worse than the food from school meals. And so today, school meals have improved so much that the food from home is worse. And what's striking about that, when you stratify food brought from home by parental education or parental income level, the higher income and higher educated parents, the meals are no better and sometimes even worse than the lower income or lower educated parents from home. Going back to the junk food data that I showed you, it's actually the higher income educated parents that are buying these sort of treats for their kids rather than getting them the healthiest food. In terms of what you mentioned, Chris, about universal school meals, we were kind of scientific advisors for a report that just came out yesterday from the Rockefeller Foundation on the true cost and benefit of school meals in this country. And what that analysis found is that the school meal program costs about $19 billion a year to run. But if you look at the economic benefits in terms of raising kids out of poverty and improving health, and also improving sustainability because they tend to be foods that are more sustainable than foods you might get otherwise. It costs $19 billion, but it brings back to the economy $40 billion. And so every year, the school meal program brings a net $21 billion to the economy. And that expanding to fully universal school meals would bring a net benefit of another $8 billion to the economy. And so I think that report is a strong argument to advance universal school meals for all. Still, not all kids would eat universal school meals. And I also don't want to say that school meals are perfect, right? You know, as I showed you, 25% of them are poor. And, you know, myself and my wife, our kids are in public school. My wife's at Harvard in nutrition too. We are fortunate and able and have every luxury in the world to send our kids with home prepared meals every day. And I guarantee you, and I've seen, you know, our home prepared meals are much, much healthier than what they could get at school. But the vast majority of Americans don't have that you know, luxury. And so we need to further strengthen school meals and also get to a place with the systems changes I mentioned that every American family could easily send their kid to school with a healthy school meal from home if they wanted to.
Right, which kind of gets to the next question I'll jump into in a moment about parents, but just to add a little bit, and this is a, you know, small group, you're part of our Catalyzing Communities family. We'll share literature with you that speaks more deeply to some of these questions, particularly around the quality of food from home, because as Dari said, it's been published. Before the pandemic, about 30 million kids were accessing school lunch and about 12 million school breakfast. Obviously, it's different now. Part of the issue with breakfast is the delivery system. So it's really come a long way in terms of breakfast in the classroom. But if you go back 20 years ago, you had to get there early, come to the cafeteria before the bell, which was impossible for most children. So this breakfast in the classroom transition that's happened, better delivery and better quality, has increased the participation. And I think that's the goal, is to get both breakfast and lunch to all children. In fact, with after school snack and summer, it will take that 10% of calories and easily double it. So if we have that, that's going to make a really big difference from school food, as you showed, versus a 10%, which is the best calories they're getting. And then, of course, with restaurants and retail, we can bring that down. So the next question is about parents.
Can I add something first before you go to the next question?
Yeah.
I think the other thing to highlight, especially at the community level for the, you know, partners on the call, is emphasizing the benefits to regional food systems, potential regional food systems of school meals. So I think both politically and from a point of view of public support of something like school meals, showing that you're helping to improve the resilience of your regional farmer network and you know, regional food systems is really powerful, is very, very powerful. And so I think that that's a big advantage of school meals and summer meals and school breakfast, is showing that, and then working with vendors who are committed to, as possible, you know, procuring from regional food systems. Of course, that's not always possible for every item. So I think that's something that is of increasing interest and hasn't really been emphasized before. And so I think for all of the communities here, that's important. Related to that, one program which I just never see highlighted enough is the USDA Fresh Fruit and Vegetable Program. So school meals are officially meals provided as part of the school lunch and breakfast program, which is an official program, has official funding. In addition, totally separately, there's a program called the USDA Fresh Fruit and Vegetable Program, which is for the same elementary schools that basically qualify right now for free and reduced price school meals. Low-income elementary schools or elementary schools from low-income districts qualify for getting free fruits and vegetables, usually from the local community, brought into school for snacks outside, in addition to usual school meals. That's been a very effective program. It's been shown to increase fruit and vegetable consumption in elementary school kids. I think we should all be advocating, every community should say, that's a great program. We love the elementary school fresh fruit and veg program. Let's expand it to middle schools and high schools. Why do we take it away from kids when they get to middle school and high school? It's not in middle schools and high schools. So I think that that's, in addition to school meals, we should all be advocating for the middle school and high school fresh fruit and vegetable program by USDA, and showing that this links to healthy regional food systems.
Yeah, that's a great comment around the ecosystem at the local and regional level from an employment, a sustainability, a health perspective, and it's really what our communities, can talk about and work on. So there are a couple questions around parents. How do we teach parents? Can we get parents to provide healthier foods to their children, cook and prepare? And we know this is challenging for a number of reasons. Access, time stress. We've published on time stress and how the American Youth Time Survey literally monitors in a sample of people how they spend their time on a daily basis. And there's no question, 2 jobs, single parent household, it's very difficult to do this. And also, told the story about how you're able to do it, but understand that a lot of people can't. So what are the kind of local systems that we can leverage to help with education and preparation skills?
So boy, I am really torn on this question, Chris. And I thought about.
I know.
I'm an educator. I've been in education my whole life, so I believe in the power of education, and it clearly is important and it clearly works. And at the same time, if you look at the graphs I showed of the improvement in nutritional quality of food from grocery stores, there's been a little bit of an improvement over time, mostly in high income and high educated Americans, not middle and low income Americans. And it's been pretty modest, and it's been a combination of all of the teaching and all of the effort and everything we've done and said, plus all of the pushing of industry to create healthier products. So I think if we keep doing that and we keep focusing on that, we'll keep seeing that slow additional benefit and widening disparities with people who need it most benefiting least because of all of these challenges, in particular opportunity cost. I'm a little bit less convinced that food deserts are a problem, especially with delivery going in. I think more and more 5 years from now with delivery, the actual purchasing itself, access won't be a problem. It's the opportunity cost. It's getting food, buying it, preparing it, getting it ready, not wasting it, coming up with a meal plan. It's so challenging. So I actually think that we shouldn't be focusing on education to individuals as the major focus. We should be fixing the system. All food should be healthier in the grocery store. All food, we need easy, cheap, ready to eat food that's healthy. And we need it to be from restaurants. We need it to be from grocery stores. We need it to be in schools. And I sort of think about, Chris, every other product we have in our economy, whether it's cars or whether it's our mobile phones or whether it's our homes, whether it's our office chairs that we sit in, all of them have safety standards. All of them we expect to be reasonably safe. We don't tell parents that, go to the toy store and 80% of the toys in the toy store are going to kill or harm your child. And we expect you to get the education to figure out how to pick the right toy. We make sure all the toys are safe. And somehow with food, it's the only sector of our economy where we know the majority of food is hurting us, and we just allow it to be present. So I really think, education should be done, because while we have the current food system, we need to help people navigate it, but we have to fix the system. And so, it does. I'm not saying we should, ban all unhealthy foods. It's nothing draconian like that. I'm saying through all the levers I mentioned, creating market demand through having healthcare dollars pay for healthier food, creating new science through a National Institute of Nutrition to allow us to figure out how to optimally process and prepare food, leveraging SNAP, which is a huge program to help create demand for healthier foods. It'll change the retail environment. It'll change. We haven't done anything in restaurants. We've been focusing on schools and grocery stores. Restaurants are untapped. Trying to figure out how to incentivize restaurants, having the federal government have tax policy, having investors invest in companies which are making healthier foods. I would love to have a day where you can go to the grocery store and you can buy anything you want, and it's going to be healthy. That should be, I think, where we should be moving.
Yeah, and that's one of the next questions around, focusing on companies and producing healthier food versus ultra processed and processed foods, and change of ingredients and getting onto the shelves healthier food to begin with. Now, it's the private sector, and although there are some things that are regulated, there are a lot of things that aren't, right? It's a free market in a lot of ways. So you just talked a little bit about some incentives, and there are company leaders, and you've worked with them, I've worked with some of them, who've said we're making a change even if the stock price falls, right? They take a big risk. They've been, they've lost their jobs, some of them. So how do we work around this? You're working with industry to help educate them and to help motivate them. What are some thoughts on this?
Yeah, so I think we've identified the industry as a crucial lever, a huge economic lever to fix food. And we have to go in with eyes wide open and know that there are legacy food companies with legacy products that want to keep them even if they're unhealthy. So we're not going to be naive. But at the end of the day, food companies are not tobacco. We don't want to just eliminate them. There's not a single product. We need big ag, we need big food, we need big retailers, we need big restaurants, we need all of the different aspects of the food system, but we need them to shift to healthier, more equitably accessible foods and still have them be profitable. And if they can do that and we can help them do that, everybody wins. Nobody really loses. And so we have started those efforts. We've created the Tufts Food and Nutrition Innovation Institute, which people are welcome to look up. And we have member organizations, including nonprofit and advocacy organizations, investors, healthcare companies, pharma companies, retailers, restaurants, food companies, trying to talk together about what this takes. And I'm not an expert on this, but from my several years of conversations with these companies, Chris, my impression is just as yours is. Most of these companies want to try to shift to healthier foods. They've tried to do it, and when they try to do it, either the consumer doesn't buy them. Well, not either. Basically, usually the consumer doesn't buy them because consumers aren't used to these healthier products, and their stock price goes down and they lose their jobs. So it's very challenging. And so what's worked is kind of stealth nutrition. Many companies have actually made their products healthier but not advertised it, because if they advertise it, the consumers stop buying it. I think that's important. But I think if we keep trying to let the market guide this just through pure market forces, right, it's going to take a long time. And so this is where, again, I think the federal government has a big role to play to come in and say, look, we want to encourage and reward food companies that are doing the right thing, whether it's farming and regenerative agriculture, whether it's retailers and the way they place and promote their products, whether it's restaurants, whether it's food manufacturers. We have to reward the companies that are doing the right thing. And we have to at least not reward and maybe penalize the companies that are not doing the right thing through tax policy, other incentives. I think if we do that very quickly, within 10 years, we can pretty substantially change the food supply. I think if we do it through the market and through consumer demand and education, it's going to take 50 years. And I don't think we have 50 years to wait.
Yeah. Exactly. We have time for one more question, but I do want to address a couple things in here that, ready to eat meals that are healthier, that are lower cost, I think are starting to make their way into the market. There's a lot of innovation. There are a lot of entrepreneurs that are working on this. And I think it's, important that we have those so people aren't just turning to quick serve restaurants to feed their families on a regular basis. I want to just ask the question about eating disorders because it did come up, and we've seen a lot recently, particularly with children who have access to social media, that there's a lot of harmful messaging out there, and there is some evidence, particularly during the pandemic, in a rise of eating disorders among children. So, do we have any insights as to how this plays into diet trends and quality, and any advice on balancing kind of the bad diet, overweight, with also the struggle of some who are suffering from eating disorders?
Yeah. Well, I think that first, I wouldn't make a person's weight status synonymous with their nutrition. And I think that's something that is first just biologically true. If somebody has overweight or obesity, or if someone is normal weight, they may still have a good or bad or terrible diet that's quite variable, and there'd be maybe other reasons. And so I think we should be talking about a healthy diet and healthy lifestyle as the goal. And I think if we talk about a healthy diet and healthy lifestyle as the goal, then that helps minimize, the risk and harms for eating disorders. And as you know, well, many people with eating disorders have highest risk of actually overweight, obesity, and diabetes later in life because they have disordered eating, and that leads to, to actually unhealthy weight gain, ironically. And so I think that's the first thing, is to focus on healthy eating and healthy lifestyle, not weight. Secondly, we of course don't want to have shaming around a person's weight status. But I also think there's been a recent trend that's too far in that direction, where we just say it's okay to be obese, it's okay to be overweight. Love your body. Love yourself. That's true, but I don't think we should be accepting, severe obesity and overweight, which really are critically maiming and hurt people's lives. Top cause of blindness, top cause of end-stage renal disease, top cause of below-the-knee amputations, right up from type 2 diabetes. So I think there's a balance in the other direction too. We can't be so worried about eating disorders that we say, okay, it's fine to be obese. It's not okay, but it's not an individual's fault. It's a disease. Right. And I think we can learn a little bit from the mental health arena, right? Where somebody has depression, we don't blame them for depression. We recognize it's a biologic disease and we help them, but we also don't ignore it. And so I think it's sort of the same thing with both eating disorders and overweight obesity. They're medical conditions that need treatment, but I think it's a very challenging needle to thread. And
yeah, I agree. So there are a few more questions, and rest assured that we will take those and make sure we get responses back to you. And Dari, everyone on the call has either already developed this map of their community with us called the causal loop diagram, or is in the process of doing that, and really trying to make change at the local level. And I think it's helpful to hear the national context and a lot of energy that's happening so that people can be working both locally at the state level and nationally to really transform, hopefully, the landscape and provide healthier opportunities for all children and families. So thank you so much for your time. Thanks everyone for joining us today. We did record this and we will make the information available to all of you. And again, we'll get out some literature to answer some more specific questions. So thank you all so much, and I hope you have a good rest of the day.
Yeah, thank you so much, Chris. And I think these individual communities are not only helping themselves, but they're beacons of innovation for state and national change. So please continue the good work and know that you're not only helping your own communities, but serving as examples for millions of other Americans.
Great. Thank you so much. Bye, everyone.